Oh my goodness, it worked today. We are live. We are going to hang out for a couple of minutes until we give people a chance to log on here. So sit tight. I'm just glad that everything is working today. All right, last day of our conference. If you guys are just joining us, hang tight. We got started a little bit early in case you saw our technical difficulties yesterday. We wanted to make sure everything worked out well. So we'll wait another 2 minutes or so for people to log on and get settled in. Feel free to start lighting up the chat and, keeping your fingers crossed everything goes well. You can start asking some questions. You can get excited. Today is going to be another great presentation. I am so pumped for this. Welcome to our virtual vestibular conference. So hang tight. I see people rolling in. We're going to get started in about 2 minutes here. Welcome, welcome, welcome. Oh my goodness, we have somebody joining us it's 2 o'clock in the morning. Welcome. That is dedication. I'm very glad to have you here. We've got Kathy from Connecticut, somebody from St. Louis, Missouri. We got people all over the place. This is awesome. Ooh, even the UK, Arizona, San Diego, Southeast Asia. Welcome. Holy cow. I can only imagine what time it is there. Some Northern California. I hope you guys have had your coffee. We've got some Orlando, South Carolina. Very nice. Maryland, welcome. Oklahoma City. Oh my gosh, we've got people from all over. Buffalo, UK, India, Vancouver. Well, welcome, guys. All right, it is 12 o'clock. Let's get this show on the road. We are so excited for day 5 of our virtual vestibular conference put on by the Vestibular Disorders Association. You have a great presentation today. And of course, if it wasn't for our wonderful sponsors, we wouldn't be here. So with the support of our sponsors, we have the University of Minnesota Department of Otolaryngology, Autonomy, and of course, Kim Bell Physical Therapy. To start us off and to kick everything off, let's hear a word from our sponsors.
Good morning. I'm Meredith Adams. I'm Associate Professor and Chief of the Division of Neurotology here in the Department of Otolaryngology at the University of Minnesota. It's our pleasure to sponsor this inaugural virtual vestibular conference on behalf of the Dr. James and Linda Hainlin Discovery Fund in Otolaryngology. Here in our department, we are committed to performing outstanding clinical care and cutting-edge vestibular research for the benefit of patients across the upper Midwest. Thank you, and I hope you enjoy this conference.
Hello, my name is Dave Weber. I am the President and CEO of Autonomy, and we're delighted to be a corporate sponsor of VITA and this first annual vestibular conference. Autonomy is a biotech company located in San Diego, California, that was founded by a Meniere's disease patient. So we understand firsthand how difficult it can be to manage hearing and balance disorders. We are committed to developing new drug treatment options for patients, and we encourage you to go to our website at www.autonomy.com to learn more about our development programs and clinical trials. Thank you.
All right, so we are about to get started with our fantastic presentation by Dr. Kathleen Strauss, and I'd love to tell you a little bit more about her. So today we are pleased to be joined by Dr. Kathleen Strauss, who is the president of VITA's board of directors and owner of In Harmony Physical Therapy, and she'll be sharing information on complementary and alternative medicine. Dr. Kathleen Strauss attended the University of Texas at Austin, received her Bachelor of Science from the University of Texas Southwestern Medical Center in Dallas, and her Master of Science in Neurological Physical Therapy from Texas Women's University in Houston, Texas. After 30 years of clinical practice, she completed her doctorate degree at the Texas Tech Health Sciences Center. Kathleen is the owner of In Harmony Physical Therapy in Houston, Texas, providing treatment to clients seeking advanced neurological and vestibular therapies. She is co-founder of Fit Fascia Solutions and My Holistic Health Plan, bringing wellness and lifestyle solutions to people of all ages. Her holistic approach is supported by advanced training in functional medicine, health coaching, myofascial therapies, and image psychology. Dr. Strauss also serves as the president of VITA Board of Directors. We are so excited about her presentation, so let's get the show on the road and get that moving. Enjoy.
Hello, welcome to the Vestibular Disorders Association's webinar called Complementary and Alternative Medicine for the Vestibular Patient. My name is Kathleen Strauss, and I'm a doctor of physical therapy and a certified health coach, and I've been practicing neurological and vestibular therapy for 30 years in Houston, Texas. In Houston, we're proudly the most diverse city in the country, and it stands to reason that we would see patients from many cultures and many parts of the world. And healthcare, like people and societies, have different cultures. And as healthcare professionals, we have to be mindful that people from all over the world have their own approach to healthcare, and many are looking to include things that are outside of the traditional Western medical model. And so today I want to talk about those complementary and alternative approaches. This is a huge topic, but today I'm just going to introduce it and touch on some of the things that people may be asking about or talking about, and whether or not those are shown to be helpful in the vestibular population. Now, if you went to the internet and you searched for alternative methods for curing vertigo, here's what you'd get. You'd get the Epley maneuver, ginkgo, ginger tea, almonds, just staying hydrated and drinking water, essential oils, apple cider vinegar, and acupressure. So that's a big bunch of things, but are those really all complementary or alternative approaches? Well, the Epley maneuver obviously is not. It's standard care for vertigo, but it comes up, on the search. So you can't always trust what you look at on the internet or what you search for. Staying hydrated, while I think that's necessary for life, so I don't consider that, complementary or alternative, but more or less essential. But we're going to look at the definitions of the kinds of medical approaches that people take today. And the traditional Western medical model that is practiced in most developed countries is the standard medical care, where there are primary care doctors and specialists and a variety of other types of medical practitioners. And in the vestibular realm, that could be audiology and physical therapy and occupational therapy and others besides the MD. Complementary medicine is describes those treatments that are used along with standard treatments. So your doctor might give you a diuretic plus a vitamin, or suggest a massage for tension related to your vertigo. Or maybe they'd recommend Tai Chi classes because they heard they help with balance after a vestibular surgery. Alternative medicine are those that are used instead of standard medical treatments. And people search for alternatives for a variety of reasons. Maybe they do it in lieu of medical advice because for some reason they don't have access to medicine, don't have the resources or coverage for medical care, or maybe they seek alternatives because of a bad experience with the medical system. But alternatives can also be used, instead of medical treatments for people who just choose to let the traditional medical approaches treat certain diseases of theirs, and then for certain ailments they don't want to have interaction between medicines, so they choose alternatives. An integrative medicine approach is a word that is growing in medical centers across the world. And this is a total approach to medical care that combines the best in standard medicine with the well-researched and efficacious complementary and alternative practices that are safe and effective. And these integrative medicine departments in medical institutions and academic hospitals treat the patient's mind, body, and spirit. So when you look at CAM, or CAM refers to complementary and alternative medicine, there are 5 types of CAM. 5 categories, I should say. There are whole medical systems like Ayurvedic medicine, homeopathy, naturopathy, and traditional Chinese medicine. These all, have things from tablets and approaches to, and include all kinds of medical approaches within those systems that align with a certain culture. But there's biology-based practices as well that use herbal products, probiotics, and vitamins. Those are all very popular now. Energy medicine includes spiritual healing and distance healing. And then there are those body-based practices that require some physical touch or manipulation of the body, like, for example, chiropractic manipulation, osteopathic, or even massage and physical therapy practice. Then there are mind-body interventions, including meditation, hypnosis, and yoga. And so all of these can be included in those complementary. I mentioned physical therapy as part of the manipulative and body-based practices, but physical therapy is not considered complementary and alternative. It's considered standard practice. Now, why do people look for alternatives? How many of you have used a complementary or alternative treatment? And why did you, choose to do that? 77% of the people use alternatives to prevent illness or promote overall wellness. 73% of people use it to treat pain. And 59% use it for specific health conditions. So, some people look for alternatives because they're afraid of drug-drug interactions. Maybe the cost of pharmaceuticals asks them to, or causes them to look for something first. And some people feel like they get better faster by doing something alternative. If we look at the people who have used CAM in the past 12 months, the largest percentage of them, almost 60%, have used either herbal products or dietary supplements or one of the body work and manipulation. So those are the most commonly used approaches in the United States, based on a survey of Americans that are over 50 done by the AARP. So if you looked at vestibular patients, there really is not very much research at all to support or to even have a discussion about complementary and alternative approaches in the vestibular patients. But in one study, they looked at 80 patients who were coming in for vestibular assessment, including an ENG or VNG. And recognize this is only 80 patients. So when we interviewed them, 16% of them, only 13 of them, had tried some form of complementary therapy for their vestibular symptoms. And among those 13, ginkgo and acupuncture were the most popular. And we looked at why did they choose it, and who suggested that they try complementary and alternative medicine. And 7 of them were referred based on a personal recommendation. Someone they knew had tried it, and they wanted to try it too. 6 of the 13 who tried it said that their their alternative treatment, was helpful for their vestibular symptoms. And this is a 2006 study. Now, when you look at the effectiveness of complementary and alternative approaches, and maybe we're critical of that, let's look at how effective regular medical treatments are. In a study in the British Medical Journal, they looked at how effective traditional treatments in medicine were, and they looked only at randomized controlled trials, which are the highest level of scientific research design. And out of thousands of traditional medical treatments, 3,000 to be exact, you can see that 50% of them had unknown effectiveness, 3% likely to be ineffective, and 5 unlikely to be beneficial. So if we look, well, how many of these 3,000 treatments were actually beneficial or likely to be beneficial? We're talking about 35% of the 3,000 traditional medical treatments are likely to be or are beneficial. So, you know, if you think about this study and the fact that, you know, it's not that doctors are guessing what to do for you, but their treatments are not always beneficial for a beneficial remedy for the assigned, you know, disorder. You can see why people look for alternative treatments that they believe will work for them. In the vestibular realm, these complementary and alternative approaches are most often used and indicated to treat the neurovegetative symptoms that patients have. These include nausea and vomiting, a sense of a brain fog, and fatigue, stress, sleep disruption, and anxiety. And, you know, these are symptoms that are not unique to vestibular patients. But they're common in particularly patients with both acute and chronic vestibular problems. So these are approaches that might bring them comfort. As we take a look at some of these more popular options, you'll see that the research is primarily looking at their effectiveness for these kinds of symptoms that go across all diagnoses. Let's begin by looking at Chinese medicine and what is it? I mean, it includes acupuncture and cupping, which is using a negative pressure to sort of suck skin into a cup and separate the superficial tissue layers. It includes herbs, meditation, and moxibustion, which is a burning of herbs over the skin, and Tai Chi. Let's see what the research says about these, or what about for vertigo patients. So this is a Chinese medicine herbal remedy that is packaged as Vertigoff, and it is described to dispel wind and phlegm and dampness, and it's designed for the Chinese medicine syndrome that includes loss of balance or sensory disturbances or nausea. It has not been studied in the United States and is not controlled by the FDA. And so, you know, this is something that the Chinese medicine field feels is helpful and uses, but we don't have any efficacy for its treatment. Another one is an injection in the Chinese medicine practice, and it focuses on the vascular assets of vestibular problems, including dilating blood vessels to improve circulation. And this might be helpful, they say, in treating cervical vertigo, where posterior circulation might be impaired. And they also say that it's helpful for post-particle repositioning for the BPPV patient. Again, no studies in the US that I can find at all. Another Chinese medicine supplement is marketed for Meniere's disease, and it's called Inner Ear Balance. This is a mixture, as I said, of different roots and herbs, and is manufactured, and it is the manufacturers advertise it to say that it improves a sense of balance. They claim that it removes ringing in the ear, and they say that it helps clear the head. The manufacturers go on to say that it's well tolerated, doesn't cause drowsiness, and has no known side effects. However, there is no research to support this particular remedy and in any scientific studies. But it says that it helps the inner ear by balancing the inner ear fluids, and I'm not sure, you know, how they measure that. That it minimizes the occurrence of vertigo, it improves balance, decreases tinnitus, and even alleviates stiffness in the neck. So a lot of claims for this without much scientific proof. They recommend 3 capsules 3 times a day, and there are lots of testimonials but no research. And so it would cost you about $100 a month to take Inner Ear Balance 3 capsules 3 times a day. I have no experience with this, nor have I had any patients who've tried it. Now, homeopathy is another area of alternative medicine, and it is defined by, it's based on two ideas. One is like cures like. That means that they believe, those who practice homeopathy believe that a substance that causes symptoms of a disease in healthy people would be the one to cure similar symptoms in a sick person. So like bee venom would cure sensitivity to bee stings. So like cures like. They also believe in least minimum dose. And so the things that they use are diluted down almost to so substantially that there are almost no active ingredients left at all. There are warnings from traditional medical doctors that say they may cause side effects and drug interactions, but again, it looks like they're quite diluted. There's very little, almost no evidence to support homeopathy as a treatment for any specific health conditions. Again, I don't have any experience with Vertifree, or nor do I have patients who have experience with it, but it's out there under the homeopathic approaches to vestibular problems. Now, acupuncture is known to most people as the insertion of these tiny needles into the skin, and it is pretty common. It is probably one of the more common alternative approaches to treat vertigo and vestibular problems. I've had most of my patients, if they try an alternative approach, it's acupuncture. And the advice always given is that make sure that you choose a practitioner who is licensed and certified in your state to practice. And there are even MDs who are dual licensed to practice acupuncture as well. This is a science of inserting needles into particular places on the body that follow meridians and lines of energy throughout the body. And a non-invasive form of that is called acupressure. And these are based on the points that lie along those meridians or channels in your body that, that house the energy. And so there are applying pressure to the areas where the needles might usually be can clear blockages and balance the energy to achieve health. Now, acupressure is well researched for symptoms of vestibular disorders, and there are 6 points that are designed to be helpful or that are selected as helpful for vestibular patients. And I do use acupressure on all of these points in my practice with high effectiveness. The most common one is the inner gate, or the P6, which is found with 3 finger breaths below the wrist, and applying pressure there can be helpful for dizziness and vertigo. The center of the top of the head is the 100 convergences spot, and so pressure there is helpful, as well as at the back of the neck and the shoulder well, which is in the muscle of the upper trap. Who doesn't love to have a thumb stuck into their upper trap? Behind the earlobe and in front of the tragus at the ear, which is this flap of cartilage, those are 2 places, and touching there with an open mouth, give access to the TMJ, which is commonly one of those places we look at when we have patients with dizziness and balance issues, because inflammation in and around that area, you know, can be happening at the same time. So if you look at this place and the P6 point, you can try it right now with me. A 4 to 5 second massage and stimulation to the area, you know, might be helpful for people with nausea and vomiting from a vestibular problem, but there's limited evidence to support that, you know, in real strong scientific studies, but it can't hurt. It has been studied in, it does not interfere with the vestibulo-ocular reflex. It can be self-administered. And, you know, what we need more research in this area. It hasn't been shown to help vertigo, but it doesn't hurt. And many people choose that. In fact, manufacturers have created what's called a C-band that, they advertise and say that it works on pressing on this point. What's funny about that is if you look at this picture, these bands are placed with the point at the wrist, and they really need to be 3 finger breadths below the wrist. So a study looked at properly and improperly placed C-bands in 204 subjects. And this was a double-blind randomized study. And for the ones who had it properly placed, 85% of them had improvement in nausea and vomiting, but not vertigo. But still, nausea and vomiting was improved. And 11% of those who had it on wrong got better too. So there's a little bit of a placebo effect there. And what the manufacturers encourage is, or they're adamant about, is that you have to wear it on both sides. So again, this picture shows it placed incorrectly. It needs to be 3 finger breaths down, and it might be worth a shot for nausea and vomiting. People use it to go on a cruise and things like that, and make sure that it is used on both hands, as I mentioned, okay? Now, Qigong is a movement in Chinese medicine that cultivates the qi, or the life energy that flows through the body. And this photo shows a group of people practicing Qigong forms. And these postures are repeated, and then you relax and move into the next form. And it combines movement and breathing and meditation and even self-massage as part of it. It's a slow meditative movement that requires very little power or strength, and is choreographed pretty simply for everyone to participate. And this is a very useful thing for many of our patients to address balance and also that calm meditative stance and focus on breath. Tai Chi is another Chinese martial art. It embraces the mind, body, and the spirit. It's gentle and not strenuous, and it has been shown to have a positive effect on strength, balance, and flexibility. And research is emerging within the vestibular population. And one study looked at 26 subjects with the vestibulopathy and compared vestibular rehab to Tai Chi. Now, both groups improved in stability and balance, and gaze improved in the vestibular rehab group, but not in the Tai Chi group. And that was a study done in 2004. In 2009, the American Academy of Otolaryngology, Head and Neck Surgery, did another study and said that Tai Chi may be an effective treatment for vestibular patients. This was based on 21 patients' subjective improvement after an 8-week course of Tai Chi. So, your clients or you, if you have a vestibular disorder, may find this very helpful in your community or even available using the internet or television. Ginger is something that is, popular for nausea and vomiting, but we have to think about nausea and vomiting and the cause of it. So the therapy for nausea and vomiting needs to be specific. And so ginger has been found to be helpful in pregnancy-induced nausea and vomiting, whereas antihistamines and anticholinergics are most helpful for vestibular-induced nausea and vomiting. So what we know is that there are different neurological pathways for different types of nausea and vomiting. There's also, nausea and vomiting caused by chemotherapy in cancer patients. So people think that, well, nausea and vomiting is all one thing, but ginger might be helpful for some nausea and vomiting and seasickness, but not vestibular-induced seasickness and nausea and vomiting. But ginger can be used in tea, it can be eaten, it can be used as a powder in food or taken in a supplement. It can be used as in aromatherapy from an essential oil or crystallized in sugar. Be careful because it may interact with blood thinner medicines, and again, is often one of those popular things that people try for nausea and vomiting. Supplements are used, I think, more often today by people who are looking for improvement in their general health. The most common used supplements are fish oil, probiotics, vitamin D, magnesium, and protein. And most of the medical model support the idea of food first, and essential supplements are felt to be necessary now for people who don't believe that our food, has as many of the nutrients that maybe it once had. So, but most all doctors, I know all doctors do support supplementing things we actually don't produce in our body, like those omega fatty acids, long chain omega fatty acids. And probiotics are found to be important to support the good bacteria in our gut. Sorry about that. Okay. So if we look at supplements designed to treat vertigo, there are some, and this one called Vertigo Heal is found to be as beneficial as beta-histine in treating vertigo. Zinc is packaged to treat vertigo, but there's no evidence for that. And ginkgo biloba has some evidence for selected vertigo patients. Tinnitus, there are supplements that are branded to treat tinnitus, including zinc and manganese and ginkgo and magnesium and melatonin and B12 vitamin, but there's really no evidence, or if there is evidence, for example, in manganese and lipoflavonoid plus, there's actually evidence to say there's no benefit in treating tinnitus. But again, that might require some further study to understand the origin of that tinnitus. We know that vitamin D supports the immune system and acts as an anti-inflammatory, and it has been researched in the treatment of Meniere's disease, those symptoms that are caused by a post-viral autoimmune disease. One study says that vitamin D helps with chronic recurrent vertigo episodes in those patients. So that's something alternative to what you might find in the doctor's office. Now, essential oils are gaining in popularity, as I think if you watch TV now, you'll see that everything from hand soap to laundry detergent and even dishwashing detergent now has essential oils in it. And not to mention just even lotions and things. Aromatherapy is quite popular as people seek out organic, pure, therapeutic quality essential oils that are distilled carefully so that the therapeutic compounds are retained. And so these are genuine essential oils or medicinal quality essential oils. Care needs to be taken because some of these cause photosensitivity or sun sensitivity. Some may burn the skin, especially in children, or sensitive skin, like peppermint can burn the skin. Some oils need a carrier oil, like a coconut oil, and obviously they can't be used near the eyes or in skin that may have a sore or an open area on it. There's a lot of bad essential oils out there that are really diluted and don't have any, therapeutic efficacy. But good essential oils can be inhaled or applied topically, and they have been shown to be useful for symptoms of nausea, sleep disturbance, depression of the mood, anxiety, and even to make one feel awake and stimulated. So these may be helpful because they have been shown to do that. Some are designed to be ingested. This says they're not ingested, but some are designed to be ingested. I know Young Living has their Vitality ingestible oils that certainly can be added to food and water and all kinds of things and are safe to be ingested in tablet form, and some are not. So make sure you know what you're doing, and there is ongoing research and more research to support the use of essential oils for a variety of things. The most researched ones are lavender, that has antibacterial and antifungal and relaxing antidepressant type effects. And it seems like there is some scientific and clinical data that support the use of lavender. And it has to be super concentrated, though. It takes 220 pounds of lavender flowers to produce 1 pound of lavender oil. So again, the quality of the oil you get is real important. So these tea tree is also highly popular and most researched, along with chamomile, thyme, eucalyptus, frankincense, and bergamot. And these may, the lavender and tea tree specifically you need to be careful because they may interfere with hormone balances. Now, nutrition shouldn't be a complementary or alternative approach, but it doesn't seem to be the first thing that many people are asked to look at. But I think that the interest in nutrition and dietary health is growing. And for a long time, we've used dietary recommendations in Meniere's disease, recommending a low sodium diet that does seem to be helpful and is useful and standard of care in Meniere's patients. The vestibular migraine patient is finding benefit from a migraine diet, especially one low in tyramine and free of additives. There's a book called Heal Your Headache, which has extensive information on migraine diet. And I think there are many migraine diet resources out there now that may be adapted for the vestibular migraineur. Also, nutrition is helpful and proven successful in preventing vascular disease and in supporting the immune system. This slide shows some of the substances that might need to be removed from your diet if you have a migraine diet and vestibular migraine specifically. And so you can take a look at this list and see things that may be related to vestibular migraines. Yoga is a Hindu discipline that includes breath control and meditation and specific body postures. And there is studies to show that practicing yoga may be beneficial to those with impaired cervical vestibular evoked myogenic potentials. And so yoga is also shown to be effective in improving balance in community dwelling people. Therapeutic eyewear and glasses of different colors are gaining in popularity, and people look to them to reduce eye strain and maybe even to prevent the triggering of a migraine. So manufacturers report that glasses that are tinted to filter blue-green light may reduce migraine attacks and decrease the intensity of symptoms, decrease light sensitivity, and reduce eye strain. So these are useful in the migraine population, and I know vestibular migraine patients who find them very useful. Precision lenses have been shown to suppress brain activity in migraineurs, and there's one other type of eyewear I see advertised called CSIC glasses that create a horizon. They're actually glasses that have water in between two panes of glass, and so the water shows you the horizon regardless of how you're tilted. And I don't have any evidence or scientific studies at hand to show those are helpful, but I'm very interested if there's anyone who has any anecdotal evidence, because anecdotal evidence is often what gets one person to tell another person, and then they try it. And if you believe it works, sometimes it does. So mindfulness is gaining in popularity and attention as it starts to be studied in relation to the vestibular client. And mindfulness is really the process of bringing attention to what you're experiencing at the very present moment in your body. And so teaching people to be present with what they're feeling rather than focused on, what they might think might be causing the symptoms or fear of symptoms being provoked. It helps decrease the overreactive nervous system and that sort of fight or flight autonomic response. Being mindful and in the present moment helps support the parasympathetic nervous system, which allows restorative healing and recovery of a lot of symptoms. And so it does reduce stress and enhances performance. It's easy to learn. There are apps and videos and all kinds of things, podcasts that people can do. And I do know that there is ongoing research about its efficacy, specifically in vestibular patients. So we support the use of mindfulness in our patients, especially those with chronic illness. Cognitive behavioral therapy may be beneficial, specifically for the anxiety that can be caused by a vestibular event. There are a lot of patients who suffer chronic vertigo and vestibular problems that get caught in this anxiety and vertigo loop or cycle. And cognitive behavioral therapy is beneficial for that. So there's a study that shows that patients do receive reductions in dizziness and disability, and they seem more willing to engage in community activities with a little more confidence when they're able to slow their nervous system down and learn strategies and techniques to break out of that cycle. Now, when we talked earlier about the safety of, traditional medical interventions, remember those 3,000 studies that, less than 35% of them were absolutely beneficial. Well, with these, we want to know if they're safe. Some of these approaches are safe and some are not safe, but you do your research, and because research is quite slow for several reasons. Time and funding is limited and just hasn't been thrown at these. It's starting to happen as patients begin to experiment with them, but it is certainly behind other traditional approaches. It's hard to find institutions to perform these studies, and many of these complementary and alternative approaches are not regulated or FDA approved, and so that presents regulatory issues. But if you look and do your own research, you want to take a look and see who did the research. Any research done by the manufacturer of the product has an internal bias and wouldn't be considered in a summary paper of research studies. So it has to be third party. It has to have, a large number of subjects that are representative of the larger population. And a good study has a control group where either they are given a sham treatment or a placebo that's similar. And that helps us understand how different the actual treatment is from just a placebo where someone believes they're getting help. We saw in one of the earlier studies where 11% of the subjects who had a placebo, also got better. So there's a lot to be said about belief in an approach. And so for many, these are anecdotally useful. And so just be careful to make sure that things are safe, that you look for, high quality products and skilled practitioners who might guide you in use of them. If you go to your doctor, you can ask them about complementary and alternative approaches, and maybe you would ask some of these questions. I put a list of questions here that might help guide you in communicating to your doctor. You might ask them, are there other ways besides medicines or surgery that people deal with problems like mine? Or you might ask them and tell them that you've heard that a particular approach or particular something can be helpful. Ask the doctor what they know about that approach. That you might ask them if they know about any studies about the effectiveness of an alternative approach that you're interested in. The doctors have access to these medical libraries and might be able to do a search and share some articles with you that either warn you about it or support its use. You can ask the doctor if something might help you and how will you know if it's working. You also want to find out how long do you have to, stick with it to know that there's a benefit. Do you need 8 weeks of Tai Chi or 6 visits of acupuncture? I mean, these are good questions, and we don't have scientific evidence to answer all these, but you could ask or you could look for those. Always think about possible side effects and interactions with your medicines. Consider the cost and ask if insurance covers any part of it. And then, of course, you can look to find more information. Maybe your doctor has a way for you to find out more information on your interest. So remember that the benefit of the powerful effect of belief in an outcome. And in these complementary and alternative approaches, people often have a strong belief in the potential outcome. And so I'll just leave you with this quote that says, "Our belief in the potential outcome of complementary and alternative approaches is sometimes greater than belief in a traditional method." And that might be the reason why some of these complementary and alternative approaches are helpful. So there's a clear need for more research in this area. And what we have so far is people who are curious, who are taking their medical decision-making into their own hands and including complementary and alternative approaches in their toolbox of things that they are using and trying for vestibular problems, and specifically those symptoms of those neurovegetative symptoms we mentioned. So I hope that this has been helpful for you, and I'm eager to hear your questions. Thank you so much for listening.
Well, what a fantastic presentation. Kathleen, I'll invite you to turn on your camera and your audio so that we can start a round of some live Q&A. Hello. Good to see you. All right, so our chat has been looking really, really great and some interesting questions that are popping up. First of all, I want to say that I really liked your slide on tips of what to ask your doctor to kind of approach the situation of getting more information on different types of complementary and alternative medicines that you can add into your care. But it's a nice nod to kind of note that we should be asking our doctors if there are any counter effects of their medications and whatnot. Is there, in your opinion, a different type of doctor that might specialize more, have more training in alternative medicines that somebody can seek out to take that path?
Well, there certainly are, and there's a growing number of institutions that offer complementary and alternative certifications, whether it be in naturopathy or homeopathy. And so there are those. I know in Texas, Austin seems to be a place where there is a lot of interest in this area. Houston being a major medical center, there's less of that. So it's very dependent on the region. And for me, having practiced in the traditional medical model, my patients come to me from tertiary care providers like ENTs or vestibular specialists in neurootology or neurology. And so when patients come, they're looking really on their own and asking people's opinion on things. But so we don't have a vast amount of experts in Houston, but I think that there are regionally probably certainly some licensed practitioners who've studied it.
Well, that's a good point that you brought up about patients having to do their own research. When it comes to something like this, we are constantly online figuring out what's been helping other people. So when you have somebody that comes to you and you have these different approaches to medicine, are there any specific resources that you guide them to in order to find the proper education and background in learning more about these types of as alternative medicine, like where to research your oils, how to understand what would be a good quality oil and what would be a bad quality oil?
Well, I like what you just asked me. Let me just say, as a practitioner, what I like about having this conversation with patients is when we take a history, it's a thorough history. So I would know what other things are going on in my patient's medical situation, any chronic illnesses they have that are unrelated to their vestibular problem, or any other, even genetic differences they may have with metabolizing certain products, chemicals, or foods, or allergies or sensitivities. All of these things, understanding the medicines that people take, the experiences they've had with medicines and substances and foods, and then any chronic illnesses they have to be considered when you look at what types of complementary and alternative approaches they might need. So I often involve ask them to involve their medical practitioner that is treating them and prescribing other medicines to get clearance for that. And that's important. Just talking to a friend about something may not be as thorough. Someone might not think that perhaps that the fact that you were cured from breast cancer years ago would have anything to do with an approach that you might use for vertigo today, but it does matter. So I think the whole medical history is important, and I ask people to look at that.
Yeah, that's kind of something that we've seen as a common theme throughout the week, right? Every single person is an individual, and their symptoms are individualized, as well as how they're going to be able to get through their journey. So, I've noticed in the chat, there's a lot of people recommending supplements that have helped them. And then there's always usually a counter saying, no, that made me feel worse.
Exactly.
So you kind of have to talk to the appropriate people to make sure you're taking the right approach, appropriate for you as an individual.
And the National Center for Complementary and Integrative Health has done 2 national health interview surveys. And they did these 3 times in 2002, 2007, and 2012. And so you can see that we're talking about the last 18 years, that this has even been really studied on a national broad level. But if you keep an eye on National Center for Complementary and Integrative Health, you can watch when they accumulate enough information to put it out there to be able to say that something has enough support in the scientific literature to be recommended or to be safe. Now, once that happens, it's no longer a complementary or alternative. It would be considered integrative. Okay. So things that were once complementary and alternative, once there's research to support them, we integrate those into the medical practice and they become a part of an integrative approach. So I think that at one time, things that we consider now standard of care were on the outside. I remember doing particle repositioning years ago or habituation exercise years ago, doctors asking me if I was a witch doctor. And this is true. So as time goes on and research is done, these will be pulled into the standard approaches for vestibular patients. And that's what I'm excited about. And it's not that I'm down or negative on any of these approaches, but I think your reference to the chat is so important because one person, it helps, and the other person says, no, this hurt me. So you have to be your own advocate, make sure that something's safe, and then try it. Ask a doctor. Like I saw someone said, my doctor said there's not enough research to say that this type of glasses, really helps. It's true. But they're out there and they're helping some people. So be careful what kind of money you spend on something, ask and get advice. And even if the doctor says, the glasses can't help, aren't proven to help, but they can't hurt. Sometimes that's all we can tell you as a medical professional is there's no evidence to say it helps, but it doesn't look like it will hurt you. So take it at your own risk. And then one day with enough information, we'll integrate all of these in if they work.
Now, in reference to the chat, it has been brought up multiple times. I'd be remiss if I didn't mention it, but do you have
I know what you're going to say.
Do you have any advice or comment on the new wave of CBD that is flooding the market?
I do. And I'm on holiday in Aspen, Colorado, and there is a CBD and THC vendor on every corner. Now, my experience with this is limited to really looking at research to prove usefulness of CBD in the vestibular patient. Obviously, there is none, okay? There is no research to show that it helps in the vestibular patient. I believe in the next 10 years, there will be a lot of research to show pure forms and how they're helpful in different things. But medicinal marijuana with THC, but also CBD that is legal everywhere, has been shown to interact with what we have. We have a natural endocannabinoid system. Our body has a mechanism to metabolize CBD and integrate it into our health. So again, it's a little bit more, it's more than just believing that CBD works. It is useful and helpful in many areas, but specific to the vestibular patient, there is no evidence, but it is certainly popular. People are using it. And I believe that the THC form will also eventually be legal. If you haven't stepped into a dispensary, as a medical professional, I'm very I was very, very nervous about going in at first because it's illegal in Texas. And I was like, okay, so what do I do? And this was years and years ago. But coming to places where it's more accepted, you can go in, and actually, I was pleasantly surprised. I went in for research purposes, I promise, because I don't have personal experience with it, but everyone's asking me. And as an expert, I needed to go in and see what's happening. But I've been extremely impressed with the care and the quality and the methodology of people who are trying to help you. You go into one and they're genuinely there to say, what can I help you with? Mm-hmm. And they do it in a format that is professional. But when you ask them if there's evidence to support it or what do they know about it, the answer is always, people say this is helpful with this. I have lots of people coming regularly for CBD for this or this or this. But again, this is all on an anecdotal level.
Yes.
So, I mean, that's my response to CBD. I know that some people are asking, as we prepare the complementary and alternative approaches website for Vita, to talk about that. But I've reached out to no less than 5 people who are high level in the industry, and they won't talk to me about specific claims for the vestibular patient. But understanding the endocannabinoid system is the first step. But again, like I said, I'm asking people to make statements about it, and they won't.
Yeah, it's hard because it's a new hot thing that's kind of flooding the market. It's kind of the Wild West. It's not regulated. Even some of these states that are legalizing it medicinally, there's not a lot of education behind how to accurately prescribe it, and then also educate the patient how to take. But I figured we should cover it a little bit. I think you covered that very, very well. It's just something else that needs to be researched and taken into consideration when moving forward. Now, with all of the oils and some of these other supplements, they can get very costly. But from your presentation, there's a lot of different things that you can do that aren't going to break the bank. Talking about yoga, Tai Chi, and nutrition. So we've mentioned the Dizzy Cook, who is absolutely phenomenal. I have her new cookbook. It's great. And there's also a lot of resources out there to find information on nutrition. Again, is this something that you point your patients to on a regular basis? Because that is something that they can change at home immediately and for really no extra cost.
Yes, I like what you said. And for me, the most successful patients who've managed long-term chronic symptoms have done it in a natural way. And that has been food and meditation and spirituality and lifestyle changes. So these lifestyle changes that include removing things that may be harmful or not helpful. So removing foods that don't have nutritional value, removing excess sugars and processed foods, eating real food, moving every day. So it's eat well and move more, maintaining flexibility and movement of the body and even touch of the body that keeps our lymphatic system healthy, keeps us hydrated and fluid moving throughout, sort of in a detoxing way. So I think we detox the mind, the body, and the spirit through some very natural ways. And those people who find that center and they find a groundedness, really modulating their nervous system in healthy choices, lifestyle choices, and then movement and healthy food and a meditative type of practice seems to be the most beneficial. And that is why, I don't have a lot of patients who have used this. I can't even tell you in my 30 years of vestibular therapy that I've had 10 patients do any single one of these for me to say, in my experience, I have research to support most of the things I've said. But yes to Tai Chi, yoga, meditation, massage, and diet, certainly supplements that used to be considered alternative are now involved. Every primary care doctor will recommend levels of certain vitamins that we have been proven to be helpful. Someone mentioned turmeric in the chat. I mean, that is certainly a popular thing, but it is now being recommended. I remember when curcumin and things were being used for joint pain, and these things are well researched now. So these are things that you can find evidence to support general health. So for the vestibular patient, supporting your generalized health with healthy lifestyle choices and supplementation is reasonable, and your doctor would support you in that.
Absolutely. And I'd like to finish up our Q&A with a question that we pulled from the chat regarding yoga or Tai Chi. And I'm sure almost every vestibular patient is probably thinking this in the back of their mind. But what do you say to the patient who says, how do you do these things without falling over? How can I possibly attempt these without falling over in class? What would you say to that patient?
Well, it's a great question. You know, yoga, we think about people standing on one leg in a tree pose or whatever, but certainly you begin any yoga session with just standing on 2 feet and rising yourself. And I tell people, imagine a string is pulling you up and gravity is pulling you down, and feel the pressure of your feet in the floor. So it's a very much a scanning process, grounding yourself to the earth, and breath. So for the vestibular patient, even applying simple yoga approaches in sitting is to embrace the breath, be mindful of breath, focus on pressure sensitivity of their bottom in the chair, their back in the chair, and feel gravity pulling them down. So there are many approaches in a holistic practice that focus on breath, gravity, grounding, and equal pressure on right and left, whether it be your right and left hip bones in the chair, your right and left feet on the floor. Even if your feet are this far apart, you still are embracing the essence of yoga by thinking about, where is my weight on left and right? Can I make it equal? Can I feel the shift left and right, or onto toes and heels? So begin wherever you are and begin understanding and accepting what you can do to find equilibrium in whatever support surface you need. Even if you want to be standing and begin yoga, stand next to a bar or a stair rail. I see patients in their homes, and we stand at the base of the stairs and begin a yoga type practice. I mean, these are just pulled from yoga, but they're pulled from lots of things, not just yoga, but the breath, the grounding, the focusing on pressure sensitivity, and connecting to the surface. So start where you are, embrace the idea of those things, and move forward slowly and carefully without judgment, suspending any judgment of what you're doing today compared to someone else. So that might mean that you find a yoga class specifically for patients who have some balance problems, and they would embrace you and you would feel comfortable and happy with it. And each day that goes on, you feel better about it wherever you are, whatever accommodations you need to make.
I love that. And thank you so much for joining us today. I couldn't think of a better presentation to cap the end of our week off of this virtual conference. I think you have a lot of really great information to give to people, and we really appreciate your time.
It's been my pleasure. Thank you so much.
Thank you. Okay, so before we move on to our patient panel, we want to take some time to hand out or at least announce our OWL winners. This is for the one who listens. We have 3 people who are our winners for 2020. And the one who listens is basically a way to acknowledge that this is the person that vestibular disorders often wish for someone who will listen to them, right? We want somebody to listen with empathy and not judgment, listen with a deep knowledge without dismissing their concerns, and listen with understanding for the emotional impact that vestibular disorders have brought onto their lives. The OWL award recognizes 2 individuals and 1 organization for their contribution to the healing power of listening. So this year's OWL award winners are Alicia Wolf, also known as the Dizzy Cook. Alicia suffers from vestibular migraine after losing her job to illness. Alicia started to develop a personal treatment plan, which included a migraine diet. She missed being able to go to her favorite food blogs, so she decided to create her own geared towards migraine patients. She also wanted to create a place where people with vestibular migraine wouldn't feel so alone. And if you guys have been watching this week, she has been coming up almost every single day, so you know she's doing a fantastic job at that. Alicia not only shares tasty recipes and diet tips, she also posts about supplements and lifestyle changes that have helped her in her own personal recovery. One of the many people who nominated Alicia said, "She personally answers every email you send her, always with a positive tone, regardless how she may be feeling that day." Alicia is also a VITA ambassador and served on the organizing committee for this actual virtual conference. Our next individual who has won one of our OWL awards is Dr. John Carey. Dr. John Carey is a professor and chief of the Division of Otology and Neurotology at Johns Hopkins University School of Medicine. Dr. Carey specializes in the health and diseases of inner ear that affect both balance and hearing. Dr. Carey is a national expert in superior canal dehiscence syndrome, Meniere's disease, vestibular migraine, and other causes of vertigo. His research interests include the normal aging of vestibular reflexes, intratympanic treatments for hearing loss and Meniere's disease, and vestibular migraine. Dr. Carey is the kindest and most brilliant doctor I've ever met, says one of the people who nominated him. He listens with empathy and truly understands vestibular disorders from a medical perspective, but also understands the far-reaching impact on an individual's life, especially emotionally. And our last award winner is the Canberra Dizziness Clinic. Dr. Sandeep Rajagopal started the Canberra Dizziness Clinic in Holder, Australia, when there wasn't any other specialized clinics for vestibular patients in that part of the country. Dr. Sandeep was the first person who could identify how all my dizziness and vertigo were interrelated and provide a diagnosis, says the person who nominated him. When visiting his clinic, you know that he will be likely running late, but since this is because he takes his time to listen to each patient, nobody is ever upset. I have been with him when he has spent over an hour with me for an appointment booked for 15 minutes. He always stays up to date on the latest research and is keen to discuss with his patients how this might benefit them. Congratulations to all, and thank you for your work in the field of helping vestibular patients. At this point in time, I would like to hand things over to our wonderful Laura Kala. And also thank our sponsors again, the University of Minnesota, Otonomy, and Kim Bell Physical Therapy. Hello, Laura.
Hello.
Welcome, and hopefully we can get our patient panelists on too. We're joined by Alicia Wolf and Toby Henson.
Hi.
Hello, everyone. Welcome to day 5. I can't believe that we're finally at the end of the week. It's been so magic. It's just been the best having everyone on and being able to listen to some of the amazing presenters. Today we have not only Alicia, but we have Toby Henson as well. We'll be chatting about their experiences with natural treatment for vestibular disorders. So I know Alicia doesn't need much introduction, but I'm going to pass over to her to tell us a little bit about her journey.
Thank you so much. And thank you for the award as well. That got me a little emotional. I think it's the pregnancy hormones. So that was really sweet. Nice to know people listen to you out there. My name's Alicia Wolf. Many of you know me from my website, The Dizzy Cook. And basically, I was diagnosed with vestibular migraine about 4 years ago after, seeing seven different doctors. It took me about 6 months to finally get diagnosed. And I had so many doctors tell me I was just depressed, that I had anxiety, that I, might have a potential parallel fistula and I would need a surgery that would cause me to go deaf in one ear. So nothing really ever sat quite right to me, especially with the symptoms I was having. I knew it was so much more than just anxiety, but they were so strange that I couldn't really pinpoint what was going on with me. And every time I went to the ER, they would tell me, oh, you just have vertigo, and send me home with meclizine. So it wasn't until my husband and I drove 16 hours. I did not drive. He drove 16 hours to take me to the Mayo, Arizona. And I went through 2 days of testing. And the ENT there walked in. He was like, you have migraine. And I said, no, I don't. I never get headaches. That's all I thought migraine was at the time. And he goes, no, it can manifest itself in different ways. And sure enough, they weren't quite sure if mine had originally kicked off with vestibular neuritis, and that's what's triggered vestibular migraine. But right after him, I was on a wait list for Dr. Bay, which I think he's come up a few times this conference. And he had like a 7-month wait list that I was on. And when I was out in Arizona, I got a call that he had an opening, and he was actually going to squeeze me in, I think, over his lunch. And so he saw me and he performed all his tests and agreed with vestibular migraine. So it was at that point I was like, okay, you know, 2 doctors I very much trust agreed on this diagnosis. And so it's time for me to accept this and look to what I can do in the future. So it's taken me, I'm 4 years in now, but about 2 to 3 years in, I started actually having dizzy-free days. So I'm kind of, a lot of that was due to complementary and alternative treatments, because when I saw Dr. Bay, I told him, you know, I'm 30 years old. I want to try to start to have a family soon. Is there anything we can do as far as medication and supplements that would allow me to either wean off medication earlier, or how can we treat this while, you know, a family plan is still in the back of my mind? So I was very lucky to have him kind of work with me on a plan that integrated a lot of these things that Kathleen talked about today. So I'm excited to kind of go into it a little bit more.
Wonderful. Thank you so much, Alicia. Toby, can you tell us a little bit about your journey?
Yeah, absolutely. And thank you guys for everybody that's here and tuned in. We're super excited that you're here. But so actually my story is pretty similar to Alicia's. That is actually kind of how I even found the Dizzy Cook. Is a friend of mine's parent was like, you've got to find the Dizzy Cook online. Her story is just like yours. I think you'll really be able to relate. And that's kind of where that originally came from. But again, kind of a very similar story. I was walking down the hallway at work one day, hadn't really had any symptoms before then, but was walking down the hallway at work, and all of a sudden felt like I was on a boat. And I was like, something with this does not feel right. But I have always really suffered with anxiety. So I was like, it's got to just be anxious. I'm going on a big trip. I had a new boyfriend at the time. So I was like, I'm just nervous. So I need to just go chill out. So I went home and laid down, and then it felt like I was on a magic carpet. And I was like, okay, well, this is obviously not correct. And then, you know, shortly in the coming days, the drop sensation started. And I mean, it immediately, I was like, I have a brain tumor. That's the only thing that this could be. This like I'm having a stroke all the time, constantly. So multiple different hospital trips. I actually ended up getting a spinal tap done by a doctor that I don't know was entirely sure of what was going on. Experienced a lot of gaslighting, which I've seen in some of the migraine pages and on the Dizzy Cook recipe chat, just a lot of gaslighting from, you know, physicians of being like, well, are you just making this up? This is just anxiety. You're having a mental problem and all of these things. They weren't grasping. They were seeing it from the perspective of, I am so anxious, it's making me dizzy. But I was dizzy because I was so anxious because I was so dizzy. So it was just, you know, uncontrollable symptoms constantly. And ended up getting a call from my friend's mom that I was telling you all about, that kind of connected me with the Dizzy Cook. She called me just to check in because I had been to the hospital like 4 times. I was no better. I got no answers, obviously, from the spinal tap. So just totally discouraged. And she called and she was like, oh, well, I have Meniere's, and they think I have something called vestibular migraine, and it is pretty new. This was about a year ago, actually, in August. So she was like, there's not a lot of doctors diagnosing it. And she was like, you know, let me try to hook you up with my doctor at Vanderbilt. Let me see if he can squeeze you in. And she called him, and it was a total miracle. I know 100% it was a total blessing. But I talked with him. He sent me an email, and he's like, I'd like to get you in, but send me a detailed list of every symptom that you're having, even the ones that feel crazy. He was like, don't feel embarrassed. One of the things that to me that felt so off-putting was when I would wake up, I felt like I was legitimately vibrating all over. And I was like, I have lost my mind, because never in my life have I ever felt like I was vibrating constantly when I wake up. So included all of the stuff that like felt embarrassing for me to even share because it just felt so bizarre. And he emailed me back in like 30 minutes and he was like, I promise you that we will get you better. We will get you well. And none of this stuff is crazy. Every symptom you're having, I've heard. And it was, I was like a total wreck. Just having somebody validate you when you had all of these people just like unraveling you at the seams that were medical professionals that you felt like you could trust. It was really, that experience in and of itself, seeing him for the first time was really healing. And so that's kind of where I started looking into different alternatives. I followed the Dizzy Cook. And so that's kind of where my journey with vestibular migraine started last August, was lots of misinformation from doctors and then finally landing in an office with a doctor who really listened.
And I think what's actually so interesting, and what I'm reading on the chat as well, is Marilyn has said that it's so interesting how our symptoms are so similar. And then there's a couple of people that are sort of obviously nodding along with us as well, that are saying, you know, I think for such a long time we didn't talk about it. I had a very similar experience to you where I ended up in emergency. And not only are we going through these symptoms, but we feel like we're going crazy because we're not being validated. So no, it is really interesting seeing people comment. So if you are watching and you have questions for the speakers, make sure you pop them on the comments and I will read them out. But why don't we talk about CAM treatments that we do daily? Alicia, can you sort of give us a rundown about what your day would look like and CAM treatment?
Yeah, so actually this has changed a lot for me through the past 4 years. And I think that comes from just new things coming on the market as well as what you need. So as my vestibular migraine started to get more under control, it kind of shifted what I needed as far as treatments. So I'm a little bit different from Toby. I actually had to start out with medication to help calm my vestibular system, which, you know, I think a lot of us are really scared to do sometimes. I was scared as well, but you know, under a good doctor's guidance and everything, it was the right treatment for me. And then I eventually weaned off of all of that medication over time and just used complementary and alternative treatments. So what has really been the most effective for me over the years has been magnesium. Particularly, and I've tried a few different brands. I've tried the combination kinds like Mig Relief. I've tried the Calm drink that you kind of mix in. And what ended up working best for me was a combination of magnesium glycinate, which is actually formulated. It sort of bypasses your digestive system, so it can not cause some of the digestive issues that maybe the Calm drink or magnesium citrate could create. So if you're having trouble with that, that's kind of something good to note. It also promotes anxiety relief and relaxation. And then magnesium threonate has actually been studied in Alzheimer's patients. So that was kind of a new one that I found that not really many people were talking about at the time. And I thought, you know, I have a lot of brain fog. I have trouble recalling words. And for someone who's normally very sharp and had a sharp sense of humor, this was very difficult for me because I felt like my vestibular disorder was changing my personality almost. It made it really difficult at work as well. So I actually started taking magnesium threonate in the morning. And I take a type called Cognimag from Pure Encapsulations. And it's very expensive, so I just take a small amount, but it seems to work super well in the mornings for my brain fog. So that was one that I still do to this day, and it helps me quite a bit. What's kind of interesting is I also add in CoQ10. I tried B2 for a little while. I've recently stopped that. But with CoQ10, and I think what's interesting about supplements too, is I was taking such a low amount because it's also an expensive supplement. And I didn't really notice a benefit from it, but I had to switch to ubiquinol, which is actually a more active form of CoQ10. for fertility treatments. And that's when I really started noticing. I was also taking a higher amount at about 300 milligrams, I think. And that's really when I started to notice a difference in my energy levels, and also controlling my vestibular symptoms. So that was kind of a wake-up call for me too, because I think a lot of us kind of discount certain supplements, and it really can depend on amounts and types. So working with your doctor on that can be beneficial. Some things that I've incorporated since I've actually gotten pregnant is a few things, like I think Kathleen touched on the acupressure band. So I wear ones called Blisslets, and they're just like cute C-bands. They're a little more stylish than your typical C-bands, but they help some with the nausea. And especially, I think they don't really help with dizziness, but they do help with like motion sensitivity. So I'll wear them on like car rides and stuff like that. A newer treatment that I've incorporated is called the Allay lamp, and it's a green light therapy. So I also don't notice that it helps with dizziness, but I do notice that it can be effective for anxiety and nausea, as well as light sensitivity. So I think, all these things are kind of worth a try. Exercise has been a big part of my treatment plan. Honestly, I could go on and on, so I'll pass this over to Toby. But massage therapy, acupressure, acupuncture, I've tried all of these treatments, and I found some things work better for me than others. So it really is individual. But
Wow.
we can go into more details about that later.
Now, a lot of people are asking for the spelling and the specifics, but Toby's posted a link to your website as well. But all the things you've spoken about are on the website under your supplement section. I know I've referenced them as well, but they're all there, aren't they? And some of the treatments that you do specifically.
Yes, for sure. And if anyone just wants to message me too, I can go through that with them as well.
Amazing, amazing. So Toby, tell us about what your CAM treatments look like daily.
Yeah, so I've got a couple of things that I do that Kathleen talked about are just typical things that she would recommend. So I obviously would recommend everybody drinks water on a regular basis. But that is actually a huge part of it for me. I can sometimes get like rid of dizziness if I can like drink a solid amount of water. Like I'll drink a whole bottle of water, and that sometimes can kick out the drop sensation. Specifically when I start like bouncing around on a trampoline, the water actually will help shake that for me, which is nice. I manage my allergies, which is actually something that my doctor, again, I know that is medical, but I think that's just something else that people maybe don't think about when they're thinking about their treatment plan. So I do like a daily nose spray. Again, I know that is actually like a medical treatment, but just something I think that people maybe don't think about as much. Exercise is a big thing for me. I can actually do high intensity exercising. I've had to work up to it, and it did take some time. So folks that are listening that aren't able to work out, just extending yourself some grace is really important. I think people just assume that if they can't get out there and run 10 miles, that they are, they're never going to be able to do anything. But I think it's all about finding something that works for you. So I like to cycle or spin. I have a stationary bike at my house, and I have worked up. I can actually like go to a real spin class now, which is nice. But walking, like it's normal, walking outside still like makes me so ill. That will bring about dizziness for me. And I know that for some people, that is like the one thing that they can do. A lot of my symptoms are really tied to my eyes. Like visual things are really hard on me. And so the trees and the green and the concrete, all of the things on a walk are really like sensory overload for me and make me really dizzy. So I think exploring exercise options are really important, whether that is yoga or Tai Chi, or, just doing like a workout video on Facebook. I've done like a 7-minute like Zumba video before. And that has always, when I was really bad, that would work. It did kick up my dizziness. And so that is to be expected. I know that when I do a spin class, it's going to kick my dizziness up for maybe 10, 15 minutes, but the lasting effect, how it helps is so worth it. It's so worth it. Even though those like 10 minutes, I'm not feeling super hot. Other stuff that I do is I also see a counselor. I do CBT therapy, which has really helped as far as the anxiety that comes along. Just outside of my normal level of anxiety, I always hum at about a level 3 on a scale of 1 to 10. So, anything that happens with my vestibular migraine like shoots me directly up to at least a 7. So I see a counselor that really specializes in CBT, and that has helped a lot, just kind of rewiring the way that my brain thinks about it. I think Alicia, you've talked about it too in like blog posts of vestibular migraine it's a traumatic, any type of vestibular disorders, because the symptoms that you feel, it has truly to me felt traumatic. I think about was last year around this time, and it is so sad to me of the way I really kind of lost track of myself. And so I would really recommend, if you're able to see a counselor, that has been super important for me. And again, just protecting my eyes. Like I said, I think my eyes are super sensitive. So I'm wearing right now migraine shields. I think those are super helpful for me. If I do anything on my computer, like at all, even if it's 10 or 15 minutes, by the end of the day, I am just like, I can barely function. I can't even look at my cell phone, like nothing. My eyes are done for. So I would really recommend that being something that you add into. I have noticed a huge difference between like migraine shields, like buying an actual real expensive, investing in yourself, I think is super important with vestibular migraine. I had some of the Amazon glasses, and they were fun because they were pink, very neat. They weren't cutting it. The $16.99 glasses were not doing their job. So I would definitely think about, investing. And right now there's a really awesome deal where you can get some money off for those.
Perfect. Wonderful. Alicia, I've had a question come in from Caroline, just asking that she'd love to know how pregnancy has impacted your vestibular journey, as hormones are quite often a trigger for her.
Yeah, and it has been a journey. So I actually ended up going down the path of IVF, and that was also injecting. I mean, I've basically been either injecting or, swallowing hormones for the past year. With fertility treatment. So it has been an interesting ride, because at the same time, you can't necessarily rely on medication as well. So I knew I had a good doctor to fall back on, and I knew it was something I really wanted in my life. So I just kind of went forward with it. And I was in a good place with my vestibular migraine at the time too. It has, I won't lie, my first trimester was really hard. And I was also on really high levels of estrogen and progesterone to sustain the pregnancy at the same time. I'm not sure if that makes a difference as far as an IVF pregnancy versus a natural pregnancy, but I did initially have some worse days where I was having a lot of dizziness, but there was only one really bad attack that I can remember where I actually couldn't use my hands, which was kind of terrifying. I haven't been that sick since I first got diagnosed with vestibular migraine and was trying to navigate my way through everything. I think continuing your treatments, I continued my magnesium per my OB. I also I also really relied on therapy, which I thought was good that Toby brought that up, because I ended up reaching out to one of the therapists I work with. I was dealing with a lot of anxiety. I think a lot of hormonal changes, nervousness about dizziness coming back. And I reaching out to that therapist and kind of going through visualization techniques, DBT, CBT. These are all really, really beneficial things. I also supported myself a lot with things like the Alley lamp, with Blisslets, anything I could naturally. I'm now getting prenatal massages. I'm back with my massage therapist, and she does a combination of acupressure, a little bit of cupping. Sometimes we'll do that. So we mix in different treatments into my massage therapy appointments, and it really helps. Like, especially if you get a lot of tension in the back of your neck or behind your ears, it can be so beneficial to do that regularly and kind of relax those muscles back there. And it's also a little bit of a form of self-care for me. There are medications. I have one IVF friend who has vestibular migraine, and she's still on her medications. There are medications that are allowed during pregnancy. It just really depends on you working with your OB and seeing how comfortable with you are as well. So you can kind of mix treatments there, and that's kind of what I've done too. One thing I meant to say this as Toby was speaking with exercise is I actually had some trouble in my first trimester, so I was pretty much on bed rest. But what my OB had me do, and it was too hot in Texas to walk outside, what she had me do was watch these YouTube videos, and it was like walking in place workouts. And I kept thinking, oh my gosh, this is so good for vestibular patients. And no one ever talks about this, but there are actually people on YouTube who will guide you into a workout of walking in place. And I highly recommend it because you get some steps in, you're in the air conditioner, you're not facing a lot of outdoor triggers like the lights coming through the trees and stuff like that. So I encourage people to look into that too if they're at home right now and they need something to do.
That is so funny, Alicia. I have a friend that is obsessed with those walking at home workouts. I have a vestibular disorder, but she loves them.
You kind of feel dorky doing it the first time, but it really is, there are different levels to it. So I think for someone who has trouble with walking outside, they're perfect. And at some points, I used to love beginning ballet in the early parts of my journey, and now we can't go to a lot of these classes with COVID. But I'll go next to my couch and do a little bar workout or just some plies or releves to kind of, get that balance back and work on that a little bit too. So there are other things to do besides yoga. Yoga was very triggering for me, and I think I've seen in the chats too that it can be for other people as well. So just finding what works for you, I think, is best.
And so a lot of people are talking, and it's been a sort of recurring theme across the week as well, is finding the right provider, providing the right doctor. So maybe, Toby, let's start with you. What are some tips of determining if someone is a reputable CAM provider and sort of getting CAM treatments? I know Alicia has sort of talked about sort of trying out the best ones, but what do you do in determining if you want to give something a go, or if you want to try something, or whether it's massage therapy or something similar to that?
Yeah, I think one of the first things is that you have to find a provider that you feel like you can be honest with. And again, my doctor, we just kind of started our relationship exchanging some emails, but part of my anxiety, which I am totally comfortable sharing this, and this is outside of like the vestibular migraine realm, just in my normal life, is very tied to like medical things, which of course, go figure, I have a huge medical outbreak, in the middle of my life. So, for me, that is super triggering. Like the thought of even having to take medicine, period, is like very triggering for me. It was very difficult for me to start taking magnesium, which I didn't mention earlier. I do take magnesium glycinate and riboflavin, but that for me was even terrifying. I was worked up for days over that. And then I realized, oh wait, I feel better, and it made it a little more tolerable. But so I was super honest with my doctor that like I would like to try to do this without medication, and what ways can you support me through those things? And so that was really nice that he was just like, I know that this is not you. He is very involved in like I help moderate on the Dizzy Cook recipe chat Facebook page. And I emailed him when Alicia asked me to do that with her. And, he shares in this. He may be watching today, I'm not really sure, but, he wanted me to send him the link to this. And so he is involved in, my recovery my healing totally, not just when I'm there. I only see him now every 6 months. So we stay in touch through email. But I think it was really important for me to find a doctor who, like my mom went to my appointments with me. It was really important to have somebody else in the room with me. To also, you're getting a lot of information. So I think being comfortable even inviting somebody to go with you to those appointments, whether that is another dizzy friend or, a significant other or whoever, a friend, whoever you have, I think it's important to have somebody. So he was really, he listened to the advice that my mom gave about what she already knew about me. He listened to me, and he was just super willing to do what I wanted. He wasn't trying to force some treatment plan down my throat. He thinks it's really important to have a team of doctors. So he's actually works in like an ear, nose, and throat facility. And so they do all different balance recovery center at Vanderbilt. And so he got a neurologist on board. He reached out to the neurologist, got a neurologist on my team. Sorry, I'm at work and I'm getting work emails. I don't know if you guys can hear those coming in. No, so he got a neurologist on my team. He also got an ophthalmologist on my team. So I have a team of doctors. All of those doctors he knows personally. He works with them personally. He recommended people who he knew would be encouraging to me. And so I think finding a doctor that is willing to help you build that. And if you don't have a doctor that's doing that, I think you got to pack your bags and head out somewhere else, which I know is easier said than done sometimes if you live in an area that there's not great resources. But finding a doctor, even if they don't live in your area, that you can, especially in the midst of COVID, there are lots of doctors that are willing to do virtual, virtual offering now. It is worth it to not drive down the road and be at a doctor that doesn't care about you, but to maybe have to fly once a year and meet virtually and email back and forth with a provider that is going to actually be providing for you. I was seeing a doctor before that was not providing and he wasn't willing to do that. So I think that's a good question to maybe add to your list of things of, will you help me get a team together that's going to help treat all of my different things? Because that has been really helpful for me too.
Wonderfully said. And a lot of people have sort of commented that they wish their doctors would talk to each other. I know here over in Australia, without the help of people like Alicia and looking at all the different things she's done, you sort of end up doing a lot of that yourself. So that's really great advice. Is maybe that is a question that you do need to ask at the beginning of your journey is, will you help me put together a team of people that are going to help me manage this? Because it's not just a one person fits everything. Like we've talked about all the different things that you can do. So no, that's really great. Alicia, do you have anything other to add to that one?
Well, yeah, I was just going to say I've had to connect my OB with my neurologist as well. They don't normally work together. They're in different medical hospitals in Dallas, but they are two people who care. So having to connect them has been fairly easy for me. And also, I needed them to kind of work on a treatment plan together. And I'm sure we'll need to even more as things progress, or, if I struggle with more issues as time goes on. But, it's sometimes you do have to do that yourself. But I think finding someone who genuinely cares, and that's what really made the difference for me when I met with Dr. Bay, was he talked to me. And on my husband, Casey, had been coming with me to appointments. And I think that's helpful for spouses or significant others to understand what you're going through a little bit more, especially if they can't fathom what you're experiencing. I highly recommend taking them into your appointments, but I also found that a lot of doctors only talk to my husband, which was frankly really rude. And just because I'm a woman doesn't mean I don't understand. I was sitting here researching all of this stuff. I knew my staff and they could talk to me like a real human being, not just my husband. So that was the difference for me meeting with Dr. Bay. Is he looked me in the eyes. He talked to me. He wanted to know everything about my symptoms, what would work for me personally, and not just talking to my husband. So that, I'm glad you said that, Toby. That was a good point.
Now, when we talk about the different treatments as well, so other than a provider, how important is it for some of the products, and even when you were doing your research initially, for CAM treatments to be scientifically proven? So maybe I'll hand over to you, Alicia, first, because you spoke a lot about the alley lamp and things like your different lists of what you provide. How do you work out if it's something that you want to try? Is it that scientifically proven that gets you, or do you read about experience? I know for a lot of us, we look to you guys, to your page, to see if you've tried it, and then we try it because we know the success that you have. But how do you determine that?
I think it was important what Kathleen said, that a lot of this stuff is anecdotal. And sometimes it can be a placebo, but if a placebo works for you, then why not? I really started off with my doctor's recommendations. So supplements are becoming a very common thing to be recommended by physicians. What wasn't in my treatment plan at the time was a migraine diet. And that can be very controversial when it comes to scientific research, just because diets are so hard to be scientifically researched. I think the keto diet has been more researched than something like Heal Your Headache, but a lot of doctors, like Johns Hopkins University, they like to use it, and it works well for their patients. So a lot of this is just from what they're seeing in their clinics, which honestly was good enough for me. If I have a big institution like Johns Hopkins that'll back something, doctors that are well respected within the migraine community, like Dr. Buchholz, or the Alley Lamp was something that was presented at the Migraine World Summit this year. So I'm always looking at, maybe there's not a ton of research to back these things, but at the same time, there's not a lot of research to back any of the medications that are out there for vestibular disorders, because vestibular migraine has only been recognized in the last 10 years. Vestibular disorders, we're learning new stuff about them every day. So even some of these medications and treatments, they really haven't been studied. I think something that, I don't know if this is really considered an alternative treatment, but neuromodulation devices are now being studied for vertigo. Dr. Bay, my neurologist, was part of a small study that used gammaCore to kind of see if that helped with vertigo attacks while patients were in his office. And they did notice a benefit from it. The only issue with some of these, like Cephally, gammaCore, is they're so expensive and insurance doesn't really cover it. So I think gammaCore is like $600 or $700 a month to kind of use that. So there's a cost benefit to some of these treatments, kind of like Kathleen was saying. You have to see how much you're willing to spend versus how much it helps you. There's not a ton of support for the things that helped me too. Like you kind of hear that acupressure may help, acupuncture may help. Acupuncture didn't work for me. I found it very uncomfortable to have needles all in my head. Not that they really hurt, but just it wasn't an enjoyable experience for me. I think some people find it very relaxing. That wasn't me. But I saw a better benefit from using that combination of acupressure and reflexology in my massage therapy appointment. So it's a little bit of doing your own research, testing out what may and may not work for you. Like I think I saw earlier, someone mentioned that the migraine shields that Toby and I are wearing, that they don't necessarily work for them. And honestly, I have Axon, I have Theraspex, I have all different types of migraine glasses, and I wear them for different things. So trying those out, seeing what works best for you. Just because something works for us doesn't mean that it's going to help you out. But a lot of these treatments, it wasn't necessarily important to me. Yeah, it helps to have doctors kind of say, okay, this is what we're seeing in our clinics and this is what helps. But at the same time, if something works for you, then who cares, right? You feel better.
No, that's fabulous. That's really, really great advice. And I know a lot of the people watching would agree with me. And, what you do for all of us is just huge. And I don't know where our community would be without the Dizzy Cook. I remember I once said to you, I was just like, you're like an Australian celebrity. I love jumping online and having a look, and everyone, the work you do is just incredible. And I know that looking at all the comments that are coming through as well, as we appreciate everything you do for us.
Yeah,
So-
and that's why I wanted to start this website. Was at the time there was nothing really out there from the patient perspective, and now we have so many great advocates like you and some of the other ones who have spoken this week. But at the time, I couldn't really find anyone besides Kayla to relate to, and thank God she's in Dallas, and we became good friends, and we see the same neurologist. That kind of worked out, and I've met incredible people along the way, like Toby. And this community really does bring you together. And I think it's important for all of us to share kind of what is working for us, because, it could help someone else. And it may be that missing piece for them too. So that's why I really love sharing what works for me on Dizzy Cook. And then also trying to I think one of the biggest problems with starting a migraine diet is a lot of people, and why a lot of doctors don't recommend it, is they think that it's too restrictive, and it can be if you don't do it the right way. If you, kind of look at all the foods you can't have and say, oh my gosh, all I can eat is chicken. Well, that's not necessarily true. There's a ton of stuff you can have. It's just sort of looking at things a little bit differently. And I think that applies to both treatments and food or whatever along our vestibular journeys, is just kind of looking at things a little bit differently and saying, okay, what can I do? I can't tolerate this medication, but what can I tolerate? What can I eat? And focusing on those things that we can do seems to be really helpful.
Definitely. And for those that are on the chat and they're listening, Cynthia's actually just posted a list on the vestibular.org website for providers. So make sure you follow that link online. And there have also been a couple of really great links around CAMs as well. Before we sort of finish off, Toby, can I go to you to maybe provide some words of wisdom for people maybe at the beginning of their vestibular journey that are looking at things like CAM, that are trying to sort of find that balance, as you so beautifully put before, finding someone that can do it all. But what would you say to someone right at the beginning, or that you had maybe wished that someone had said to you right at the beginning?
I think one of the biggest things is you're not alone, which I know is such a cliche, but things become a cliche because they make sense. You can see, as of right now, there's 155 people in this room. And I think other days there have been, tons and tons of people that have been a part of this over the last few days. So look on Facebook, join a group, find people on Instagram. It's just like anything. It's if you are wanting to become an advocate for arthritis, or you want to get involved in like a weight loss plan, or, you really want to figure out who you're going to vote for, whatever that looks like. You flood your Instagram, you flood your social media pages, you flood your life with those people. And there are tons of people in the community that you can do that with. You can follow all of the people on this page. My Instagram handle is @October Henson. Like, feel free to join me there. When you see it, it doesn't feel as abnormal. I think we see that so many times in the group, or just like, I'm the only one. I feel so isolated. Nobody gets it. Fill your life with people who do get it, and it doesn't feel as isolating. Like, not being able to eat cheddar cheese on your hamburger doesn't feel weird if you have 15 friends eating American cheese. It just doesn't feel as isolating. I think that's one of the biggest things. And two, when you're thinking about doing alternative medicines, is just understanding that it's not going to be immediate. You're not going to take a magnesium and immediately 5 seconds later feel better. So I think, again, resting, doing things that do make you feel better. I'm an avid bubble bath taker. There's not a single thing in this world that a bubble bath won't fix. And so I'll take one of those until I know that the magnesium will kick in and I'll feel a little bit better. So just extending yourself some grace. And understanding that that's something that you're dealing with. But I always try to tell myself, I'm not sick. I'm not a different person. I do things a little bit differently than I used to, pay attention to things a little bit differently than I'm used to. But I'm not any different. I'm still the same person. And I think, honestly, I'm better because of it.
And will you share your Instagram handle and how people can find you in the chat? We've had a few people that are so keen to sort of start talking to you more. Is Instagram the best place, or is Facebook the best place, or you'll pop up both?
Yeah, you can catch me anywhere. It's a little confusing. So for everybody listening, my first name is actually October, but I friends. So that is where you'll catch me on stuff. So I'm on Facebook at Toby Henson. And I am on Instagram at October Henson. And I'll drop all that stuff in the chat real quick so you all have got it. I look forward to connecting with some of you.
Wonderful. Alicia, what would be your advice for people that are at the beginning of their journey?
I would say that, don't expect for things to change overnight. I think we all want that quick fix and we just want it to be over. And even if you do decide to go down, Western medicine or do medications or try some of these alternative therapies, everything takes so much time. So just really having hope and believing in things changing and celebrating the small wins. I think I said it earlier this week, but you have to celebrate that one, few hours that you had without maybe that constant dizziness. Even if you have it every day, just celebrate that moment and try to think of, maybe keeping a journal or something like that to see what you're doing that might be contributing to those moments of either lower dizziness or not having a vertigo attack in a week, or really, I wish I would have appreciated things like that more, because I focus so much on being dizzy every day versus understanding, oh my gosh, I haven't had a debilitating vertigo attack in 3 months. I mean, that's huge. So focusing on those small wins and celebrating them, it will kind of keep you motivated to keep trying and keep up with everything that you're doing, and just hoping that all this stuff will eventually work out. And it did for me. I mean, I feel 100% today. I don't have any dizziness. Most of my days I feel 100%, even through pregnancy. So it is possible to heal and to feel better. And I just want people to know that. I mean, it does get better, and I'm proof. And Dr. Bay used to tell me all the time, he used to say, there are patients I never see anymore because they're either found what works for them and they just manage it, and that's how they do, or they just completely went into remission and they don't have to worry about it anymore. And I think that was one of the best things that someone could have told me, was there is a lot of hope. And I think even Toby's done an incredible job managing without any medications, which is amazing too. So all our paths are different. So just trust the path that you're on and give it some time and give yourself some grace. That would be my biggest advice.
Amazing. Well, we know that the conversation could keep going. We always get to this point and there's so many more things that we want to add, and people are talking in the chat. But please visit the conference forum. You can keep asking questions there. They will be checked. It's just vestibular.org/forum. Look for the topic CAM. Thank you, Alicia and Toby, for jumping on and sharing us with us today. It's been fabulous. Day 5. I can't believe it. Thank you so much, everyone.
Yeah, and if people want to get in touch with me, you can email me. I'm Alicia@thedizzycook.com, or I'm on every social media. I have YouTube videos. Just search for The Dizzy Cook and it'll come up. Beautiful. Oh, and my book. I have a book. It was published. It came out this year. It was published in February, and actually I had both Dr. Buchholz from Johns Hopkins and Dr. Bay review it, and also Dr. Edward Cho out at House Clinic in LA. They've all kind of looked through it and approved everything. And it's just a bunch of recipes for a migraine diet, make your life a little bit easier. There's my whole story about going through vestibular migraine and struggling with vestibular disorder. There's some info in here on natural treatments as well. So if you know anyone with a vestibular disorder, I think they would really enjoy it, or migraine, I think they would enjoy it.
That's the best book.
Yeah.
It was like Christmas when that book arrived. It was Christmas, and I think everyone, especially over in Australia, that gets it always posts it in because it's such a treat. Because absolutely.
Yeah, and I'll just plug this one too. This is my neurologist book. It's Dr. Bay's Victory Over Vestibular Migraine. And it just came out, I think maybe a month or so ago, but a lot of people have been saying it's really helpful. So you can get that on Amazon as well. And it kind of details, he talks about CBD in there. He talks about a lot of different supplements. So I highly recommend that one too.
Both are definitely big staples for anybody with vestibular migraine. I highly recommend. Even just regular migraine. I have migraines, not vestibular, but I do have migraines, and both have been a huge help for me. So thank you for putting that together, because it's been amazing to have some variety in my diet.
And my publisher, she actually has vestibular migraine. So that's how she found me. So it's been edited and looked at from that point of view as well. So there's a whole group of vestibular friends kind of working on it, which is neat.
I like it. And congratulations again on your OWL award.
Thank you.
Really deserved. I mean, it was fantastic to see that you were one of our winners this year. So congratulations.
Thanks, guys.
Well, I mean, I couldn't think of a better ending to this entire week of vestibular conference virtually with Vita. Thank you again to all of our sponsors. We have Otonomy, we have the University of Minnesota Department of Otolaryngology, and Kimbell Physical Therapy. If you guys want to continue to see events like this occur again in the near future, and even have this virtual conference again next year, please consider donating to Vita at vestibular.org/give. For any of the topics that we covered this week, there are forums at vestibular.org/forum. Be sure to drop some more questions there if you want some more answers. And we really, really appreciate you guys sticking with us and staying tuned in. And also keep in mind that if you weren't able to attend some of the days and want to access some of the presentations, they will be made available for $20. You'll have recordings from the entire week, including our presentations and patient panels. So thank you so much for a great, great day and for a great week. And we really look forward to doing this again with you guys next year. Have a great one.
Thanks, Danielle.
Thank you.
Thanks, Laura. Thanks, Toby.